New nurses, your urinary assessment is more than just did your patient pee today. Hey, my name is Nurse Key and welcome to the New Nurse Boot Camp. Today we're going to talk about the urinary assessment. Let's start with urinary output. Just like with the GI system with bowel movements, your patient can be continent versus incontinent. Continent means that the patient can tell you that they have a sense to either urinate or defecate, and incontinent means that they have no sensation. They're unable to tell you when they have to go. With urinary output, either it's going to be where they're able to toilet themselves. You can assist with an external catheter or indwelling catheter, which we call a Foley. So if they have a Foley, it's easier to measure the output versus sometimes when they're independent and toileting themselves. But you could put a hat in the toilet to catch it. Either way, you want to measure the intake and the output. So with urine, you're going to look at the characteristics like a normal urine color, which should be yellow to amber. It should be clear with no sediment, no discharge, no mucus, no blood in it, and it should really have no odor. Anything outside of that will be abnormal, and it should be documented as well. You're also going to look for symptoms like burning, frequency, which means like they have an increased urgency to go. Another symptom is urgency, where it's like they feel like the need to go is pretty strong. Another symptom would be incontinence. Again, we've already talked about that. Or burning or pain with urination. Also, is hesitancy. Sometimes this can be found in males with an enlarged prostate or difficulty to start or stop their stream. And then bladder distension, which is like looking at the actual skin, and you'll see like it's almost like perineal distension in that area, and that could also say that they have a full bladder if they're not, or they're retaining urine. Another symptom, urinary retention. You'll see that even without a Foley, let's say they're retaining urine, their baseline is generally like 300, maybe they only peed 100, their bladder is distended just by appearance. You could bladder scan them and it'll say, oh, they still have about 300 in there. You may have to do a straight cath or you do an indwelling Foley, just depending on the situation, the orders. So for GI and GU, they generally go together. Incontinent in one, usually incontinent in the other one. You do the intake, how much do they drink, how much do they eat, tube feeding, IV infusion intake, and then output to see what comes out urine wise or bowel movement wise. And then you look at lab values. So for urinary system, we'll look at creatinine and BUN. The higher those go, maybe the lower their urine output may be. And then also look at if they're fluid overloaded. You'll see a lot of swelling and the urine output may be low. You could give diuretics and then the urine output will be high and maybe a little bit clear. Or are they dry and fluid and it's like they're peeing out a lot. So just depending on the patient situation, your assessment will be different, but try to do a full assessment so you can correlate your symptoms to actually what the client picture is.